Hello, my name is Ralf Friedrichs. I'm an author, addiction recovery coach, a life coach, and the host of this show, To Take Your Life Back, today's show. I did this program on my radio show, and I want to do it today on video as well. Some parents introduce kids to drugs. 1 in 5 drug abusers in some treatment programs in the United States receive their first taste of these illegal substances from their own parents, usually before the age of 18, a new survey shows. The survey found that drug treatment candidates at 70 Phoenix House drug treatment programs in the United States are 19 times more likely to have been introduced to illicit drugs by their own family members than professional drug dealers, according to Penn, Schoen, and Berlin Associates, the national research firm in New York that conducted this study. 20% obtained the drugs from their parents, and of these 6% even used heroin with their own parents. Unbelievable. These findings should disturb everyone involved in preventing drug use among kids, says Dr. Mitchell Rosenthal. He is a psychiatrist, president of the Phoenix House. Rosenthal believes that the findings of this survey reveal too many parents in America view teenage drug use as little more than a rite of passage. The study does not apply to general population of drug users. However, it's important to realize that these are kids who have already gotten into serious trouble with drug in the past, says Elise Booth, spokesman for National Center for Addiction and Substance Abuse at Columbia University in New York City. Folks, please, I don't think 20% of parents across the country are smoking dope with their kids. This is what I truly believe. A large majority of baby boomers did use illegal drugs and are more likely to have benign attitude towards their kids using them. And that's the problem here. The survey noted that similar levels of parent-teen drug sharing among whites, blacks, and Hispanics, as well as among urban and suburban residents, are likely. In this survey, we met the neighborhood pusher, and he is a lot like us, Phoenix House, Dr. Rosenthal stated. Stephen Higgins, a professor of psychiatry and psychological at the University of Vermont in Burlington, says addiction professionals have known for some time that most people are introduced to drug use by friends and relatives and not by a professional local drug pusher. But he says that this may be the first formal study that attempts to quantify that phenomenon. According to the study that they had conducted, 36% of the respondents were introduced to drugs by a neighborhood friend, 29% by school friend, and 19% by relatives. Family members who introduce youngsters to drugs include siblings, parents, uncles, aunts, cousins, and their own spouses. Of those who use drugs with their parents, 76% used marijuana, 19% used crack, 6% used cocaine, and 6% used heroin with their own parents. Prevention starts where? The study poses significant questions about drug prevention and education campaigns, which call parents the anti-drug and urge them to talk to their children about the drugs and its dangers in many households where parents do not embrace anti-drug values, according to a statement issued by the Phoenix House. Other addiction experts also question the value of anti-drug tactics in light of the survey. For children who are exposed to drugs at home, school and national drug prevention campaigns become totally worthless, says Dr. Peter Rogers, a pediatrics and addiction specialist at Children's Hospital in Columbus, Ohio, who also serves on the Substance Abuse Committee of American Academy of Pediatrics. He called the survey's findings shocking, even after working in substance abuse for 15 years. The message that is very clear here is that parents can have an impact on their kids, says Columbia's Booth. She believes parents are unaware of the extent of their own influence as role models, both positive and negative, on children. Parents have to send a very clear message to their kids about not using drugs, and those parents who use illegal drugs such as marijuana are likely conveying very mixed messages. Family systems are powerful forces in shaping the attitudes and behavior of our children, agrees Scott Basinger, chair of substance abuse counsel at Baylor College of Medicine in Houston, Texas. This information suggests the problem is not out there, but in here, in our homes. He says the survey suggests more efforts and resources should focus on families and education rather than in support of the law enforcement effort attempts to stop dealers, adding, I hope the Office of National Drug Control Policy considers the survey and its data therein. The survey funded by Phoenix House looked at random sample of 528 current residents at Phoenix House drug program in New York, California, Florida, and Texas. Residents responded to 80 questions about their drug history and their views on substance abuse treatment and policy issues. Folks, Phoenix House is a private nonprofit substance abuse treatment, prevention and education program serving over 5,000 adult adolescents in 8 different states. Call me at 844-405-HELP. Together we can help each other take our lives back. And remember, be good to yourselves, be good to each other. And a simple smile to a total stranger can change that stranger's life. It could even help your own life. And remember, it all starts at home. Be a good example. Be a role model. May God bless you. May God bless this great country of America. And remember, God loves you. Please reach out to him for guidance and direction. Take good care. Bye-bye.